in the West Midlands.
It's 18 minutes past 7 here on Sunrise. If you're heading out of the door, heading to work, then this may interest you. More than half of working adults believe their employer isn't doing enough to support their well-being. As workplace-related stress and mental health issues are on the rise, as we know, more services like cognitive behavioural therapy and chiropractic treatments are needed. But in a new survey, 70% of people think the NHS doesn't have the budget to cope. Interesting, isn't it? Well, wellbeing expert Richard Holmes joins us in the studio now. So, Richard, we heard there a little bit about what people struggle with at work. Give us a bit more detail.
Well, at Westfield Health, we have a saying, we believe in well-beings. And while the ideal is that we should all be well-beings, the pressures of modern life and work sometimes make that difficult for us all to achieve. What we're finding with organisations and businesses is that they're investing in wellbeing primarily as an engagement tool. They want to create a great place to work, motivate their employees, and just create that feel-good factor that they hope will enhance productivity. But there are a huge number of issues out there that, as you've alluded to earlier, mental health is a big one that we're all hearing about. Similarly, energy. We're at the bottom of the league table in terms of productivity levels in the UK. But I don't know whether, have you heard of the phrase TAT? T-A-T-T?
No.
New medical acronym, stands for tired all the time.
OK, new one on me.
Well, new one on you, but a recent survey of GP practices, 300 GP practices, suggested that 20% of visits to the GP are related to tiredness and fatigue. Now imagine the impact of that on an organisation's productivity levels, or even on your own individual quality of life, inside work or outside of work. OK, so you go into organisations and you help them develop programmes to look after the well-being of their staff. But there are going to be lots of bosses watching this thinking, hang on a minute, this sounds very expensive. Why should the onus be on me to provide these services when the NHS should be providing this? Well, I think we have to look at this from a societal perspective. Who should be responsible for the spend on an investment in well-being? Well, we know employers have got a self-interest in terms of the health of their employees. If employees are operating at peak performance, the business should be likewise. Our research that's recently been commissioned demonstrates that actually 2/3 of the population don't believe the government's doing enough to promote well-being. So should it be government? Should it be the employer? There's a third party, which is you and I.
Ourselves,
individuals, exactly. So one of our partners, the Advanced Wellbeing Research Centre from Sheffield Hallam University, provide academic research into all the programmes that we run. And the one thing that they make very clear is you can't force behaviour change. So ultimately, making healthier choices is a decision and a responsibility that you and I have got to take. But employers can support us. Government should perhaps be looking to support us more than it is at the moment. It has a problem with the NHS, we're all aware of that. The NHS is spending all its money on treating people. What we need to be focused on is how can we raise money through government, through employers, to actually prevent as much of that illness as possible.
OK, so if you run a small business, perhaps employ 10, 20, 30 people, and you're thinking, look, this would be a good idea to try and boost the well-being of my employees. I don't necessarily want to spend a huge amount of money. What would be a very simple, quick solution?
Simple, quick solution. How about a monthly campaign, different topic each month, just there to engage and educate people. Starts to bring it onto individuals' horizons, starts to get them thinking, because the key thing for us and our role really is to coach people to change their behaviours. To get to that place, to enable us to do that, we've got to get people engaged and interested in their own personal well-being in the first place. And they're really quick, simple solutions that can be put in place.
Great, lots to think about. Thank you very much, Richard Holmes, wellbeing expert. Thanks for coming in and talking us through all that. One thing we can all do, of course, is more exercise, get a little bit fitter. That helps our well-being. Jackie knows all about